And good morning, everybody. Can you hear me okay?
Yes.
Great. Thank you. Well, good morning, everyone. And Chris, thanks for that introduction. As he mentioned, my name is Ryan Loke. I'm the current Deputy Commissioner and Chief Health Policy Officer at the Department of Community Health. And in that role, I get to oversee and help lead the operations of the Medicaid program and the state health benefit plan as well, and then get to handle some enterprise-wide functions on behalf of DCH. It's really, I've been in this role since July 1st of 2021, coming up close to a year now. And it's really been a tremendous experience. And before I dive into this, I want to take some time to thank the Medicaid team, specifically Lynette, Brian, Catherine, Dr. Holloway, Rebecca, and all of the folks who work in Medicaid for putting this on and being there to serve and having the opportunity to help the most vulnerable population, the 2.6 million members who are enrolled in Medicaid today. But to you all as well, thanks for being here today. The agenda really does look tremendous. And again, my thanks to the Medicaid staff at DCH and the Gamewell team for the opportunity to bring providers and the agency together to learn about how we can best support each other to address the healthcare needs of the vulnerable population, that 2.6 million members strong, that we all serve and are called to serve every single day. As I mentioned, I joined DCH in July of 2021, along with Commissioner Kaylee Noggle, and we really came in and focused on three kind of core areas that I hope you guys as providers have seen really kind of mature and develop over the last 10 months or so. And those are quality, accountability, and transparency. And every meeting that we start, every conversation that we have, every policy objective that we're trying to approach, we have those three core tenets of quality, accountability, and transparency in mind. So thank you again for allowing me to be here today. Chris, why don't we jump ahead to the agenda slide, if that's okay? There we go. So going to be fairly brief this morning. I want to get you guys to the meat of what you're here to be a part of today. I'm going to talk a little bit about some of the current strategic priorities that DCH is undertaking, give a little bit of an update on some of the procurements that are either in flight or about to be in flight, talk a little bit about the enrollment trends that we're seeing in Medicaid, and then finally hit on the most important thing, which is provider revalidation. So Chris, why don't we jump to the next slide? Can folks still hear me?
We could hear you now, Ryan, I think.
Okay. Why don't we jump to the next slide? Great. We'll go one more forward. Great. So a couple of the current priorities, and there are 7 of these that I want to touch on, and we'll dive into a couple of these in more detail later on in the discussion this morning. But we'll start with the COVID-19 public health emergency. We're actively engaged in conversations with CMS and our sister agencies at DBHCD and DFACS, DHS, and Public Health about what happens when the federal public health emergency ends. As you guys are probably aware, the state's public health state of emergency ended about a year ago, but the federal public health emergency, which allowed a tremendous amount of flexibilities both on the member side and the
Ryan, I think you're muted.
Thanks, Chris. Not sure what's going on there. But like I said, we're still under the COVID-19 public health emergency on the federal side. That's currently still in place. We anticipate that it will expire at some point and are actively planning for what happens post that and the flexibilities that are in place both on the member and provider side. And I'll talk a little bit about that in a second. Again, we've talked about this both prior to me joining DCH under Blake's leadership and Lynette's leadership, but also continuing into this space, reducing maternal mortality and morbidity in the state. Everybody who is on this call knows the absolutely abhorrent rankings that Georgia has in both infant and maternal mortality. And we've got some pretty lofty goals in the Medicaid program to address some of that. And I'll talk about some of those priorities here in a second as well. EVV, electronic visit verification, you guys have all been a part of. I want to give a shout out to Brian Dowd and his team for getting the first phase of EVV certified. That has been successfully implemented for personal care services, and we're now moving towards the implementation for the second phase, which is on the home health side. Next is MMIS or GAMIS. We're federally required to transform the way that our Medicaid system operates and provide a more what's called modular approach to this process and bringing a more streamlined ability for you guys to interact with the system and transforming the way that we go about that and really trying to reduce the administrative burden on providers. A couple more if we can jump to the next slide, Chris. These I'm particularly excited about. The Medicaid staff know that one of my favorite topics to talk about is value-based purchasing. We are in process right now of hopefully implementing a value-based purchasing model in the Georgia Families Program. The General Assembly is assisting us with a little bit of funding on that. The General Assembly is set to adjourn next Monday, and hopefully that funding holds. And if it does, we're going to be moving towards a more robust value-based purchasing program on the Georgia Families side. That already exists to some extent on the Georgia Families 360 side for those of you that serve our foster care, juvenile justice, and adoption assistance population. We're going to identify some strategic quality initiatives, partnering with the managed care organizations and you guys to implement value-based purchasing. And hopefully we'll have some updates on that moving into the summer. Next one is the home and community-based spending plan. One of the federal bills that passed through Congress and was signed by the president, I believe about a year ago, allowed for Georgia to, for the first time, really make a strategic investment in transforming the way that we provide HCBS services in this state. We have received approval of that spending plan. It is posted on the DCH website, and I would encourage you to go take a look at that. There are a whole host of items in there ranging from rate enhancements and workforce development and a case management system that we're in process of developing and a couple other really exciting things. But the one that I'm most excited about and one I think that's going to have the most amount of impact on the populations that we're here to serve every single day is the addition of a new service, and that's for behavioral aids for children diagnosed with autism. These behavioral aids are going to be able to provide in-home services to assist children under age 21 diagnosed with autism. And for those of you that have been following the General Assembly over the last couple of years, there's been a really concerted focus on addressing children and youth that we serve with autism and other behavioral health issues. And we think that this addition of the new service is going to provide a really tremendous impact to us. And then lastly, a couple procurements that are in flight, and I'll delve on these or dive into these a little more here in a minute. But our CMO procurement is forthcoming. Many of you are aware that our current CMO contracts are set to expire on June 30th of 2024. We've got to be back in a position to go live with new contracts and a potentially new program on July 1st of 2024. So we've been engaged over the last year or so in doing some deep data dive on the existing program, reviewing the contracts, talking to folks internally at the state about, kind of what works well, what doesn't work well, and how do we provide the best value service to the Medicaid members that we serve every single day. We're going to be reaching out to the provider community this summer to get your feedback on those questions as well. So look forward to that probably in the June to July timeframe. But that's really one of the biggest procurements that the state has, and certainly the biggest procurement that DCH has, and looking forward to engaging with you guys as part of that process. We've also got the NEMT procurement, our pharmacy benefit manager procurement, and third-party liability that are either in flight or being discussed right now, and more to come in the coming months on those. Chris, why don't we jump to the next slide if we could? Keep clicking a couple, Chris. Let's see if we can get the text to pop up. There it is. Well, while the text is loading on this, we've talked about the public health emergency a little bit already. We're anticipating right now that the current extension of the federal public health emergency will be announced hopefully sometime in the next 2 weeks, and will run for another 90 days, taking us through probably the end of July, late summer. During this time, we're going to be continuing to keep all of the existing waivers and flexibilities in place that are currently in place. But as we talked about, we've got to prepare for a day when the federal public health emergency goes away, and those flexibilities leave the state, and kind of what happens kind of post-COVID PHE environment. Based upon discussions with our federal partners at CMS, all of the state Medicaid agencies have been advised, and strongly advised rather, to begin preparing for the end of the federal public health emergency. We talk about this kind of colloquially as unwinding. CMS has committed to give states 60 days advance notice prior to the end of the PHE, and we expect them and hope that they'll honor that. But there's a lot that will happen over the next couple months as we prepare for unwinding, both on the provider side and on the member side. Most of those flexibilities that are in place that were started in March, April of 2020 will likely end. But it's our commitment to you that we're going to provide as much advance notice as we can, as much as we get from CMS on any of those flexibilities that are going away, and what those required changes will be, and what the impact will be to both you guys and the members that you serve. I think it's incredibly important that you guys monitor the GAMA site for banner messages, as well as communications that are coming from the CMOs, because this is going to be your best source of information as to what the state's intentions are when the public health emergency ends, and what will happen after that. One of the important things, though, that I want to hit on is we've heard from many providers that the telehealth flexibilities that were put into place as part of the federal PHE have really provided tremendous value to you guys and to the members that we serve. And it's really been positive, and I'm glad to see that we're moving in that direction. We're in process right now, working with our team internally on reevaluating the telehealth model, but it's our plan to maintain as much or most of the policy changes related to telehealth during the PHE that will continue kind of post-PHE environment. We're going to be working as closely as we can with our sister agency, the Department of Public Health, to ensure that telehealth services are available in not only urban areas, but rural areas of the state. So expect more communications on that in the coming months as well. Couple other things that I just want to hit on with the PHE. We have seen well child visits and immunizations drop fairly significantly over the course of the COVID pandemic, and are trying to get the CMOs and you guys to re-engage in those efforts and make that a strategic priority over the next couple months. So more information coming, I think, in one of today's sessions about that. And then lastly, we know that COVID has had a tremendous impact on the vulnerable population that we serve. And we've talked a lot over the last couple of years, but no more so present than now, about social determinants of health and health equity. And we're working right now to enhance and develop greater partnerships, working with you guys, but also working with the managed care organizations as well, as to, how we address social determinants of health and health equity. I want to give a shout out to AmeriGroup, one of our partner CMOs. They've entered into a pilot program with a group called Mom's Meals, which provides pregnant women with diabetes some medically tailored meals, and hoping to expand that pilot over the next couple months or so. But a lot of things like that we're hoping to enhance and be able to partner with you guys in the coming months. Moving on to postpartum coverage. Many of you know that Georgia is currently operating under what's called a Section 1115 waiver that extended our postpartum coverage an additional 4 months for a total of 6 months for women who gave birth on the Medicaid program. It's our intention, and we've got the General Assembly's support and some federal law that has passed as well that gives us the ability to transition this to 12 months postpartum coverage beginning on July 1st of 2022, which will be the beginning of state fiscal year 2023. Currently in process of planning for that and working with our partners at Gainwell. More to come there as well. And you can see some of the stats there on the bottom of the slide of the number of births and pregnant women that are on the Medicaid program and how important moving towards a full year of postpartum coverage is going to be for the population that we serve. Continuing on to the next slide on electronic visit verification, I won't spend much time on this, but just know that we have received certification. Again, shout out to Brian Dowd and his team for being able to accomplish that. We are moving towards phase 2, which is the home care services side. There's a specific session about EVV today that I would encourage you guys to attend and get more information on. Moving on a couple slides to the procurements that are in flight. We've talked about most of these already, but again, want to hit on that the CMO procurement is forthcoming, not a firm timeline yet, but we are going to be reaching out to the provider community, advocacy organizations, provider advocacy organizations, member advocacy organizations, hospitals, really everybody that has or is touched by the managed care program in the state of Georgia to get their honest feedback of what's going well in managed care, what could be improved on, what do you like about it, what do you hate about it, and what do you want to see out of the next round of managed care procurements. And I've talked about the other 3 procurements that are either in flight or about to be in flight already. I can't say much about those, but know that those are in process. Why don't we jump ahead a couple slides to enrollment trends. As many of you are aware, and we've talked about a lot today, the federal public health emergency being in place. As part of one of the conditions for receiving some enhanced funding from the federal government during COVID for the Medicaid program, states, and as part of receiving that funding, were not allowed or not permitted to, rather, redetermine any persons who were on the Medicaid program except for persons who moved out of state who unfortunately passed away. And so since COVID began to today, we've seen a pretty tremendous growth in the Medicaid program from 2.1 million members in March of 2020 to 2.6 million members when they ran those numbers a couple days ago. It's our intent, working again with our sister agencies at DFACS, DHS, and a couple other folks as well, that as we prepare for unwinding, we want to have the least disruptive process that we can for members who are going through the redetermination process. And I really want to harp on and hope and ask a question, or rather make an ask of you guys to help us with this. If you guys, as you're interacting with Medicaid members and their families, if you can encourage them and update in your system and in the CMO system as well, addresses of the Medicaid members and their families, because that's really going to help us as we start to send out notices if and when the federal public health emergency expires. It's our intent to use the full amount of time that we can that's permitted by the federal government to get our Medicaid rolls back into a correct position, if you will. We've got 12 to 14 months post public health emergency expiring to do that. But in order to do that, we've got to have accurate information to get to these members and their families. So if you guys can help us with that, that would be incredibly tremendous. Moving on to the last thing that I want to talk about, one more slide, Chris, is provider revalidation. And we've got to hit on this every single time. This isn't a DCH thing. This is something that's required by the federal government. And I've just got to hit on it and remind you guys that all providers have to revalidate their enrollment every 5 years. And if you don't revalidate your enrollment, you're suspended and or terminated from the Medicaid program. And we don't want that to happen. We want to work with you guys, but as you're getting notices from Gainwell and from DCH and others, please make sure that you're revalidating your provider enrollment. And with that, Chris, I want to thank you guys for allowing me to sort through a couple technical difficulties this morning, but also, give me a chance. I don't get to say this often, but thank you guys for what you do and for serving the most vulnerable population in Georgia, the 2.6 million Medicaid members and their families that we serve. You guys really are the backbone of community health in Georgia. And I can't thank you enough for what you do every single day to provide access and care to more than 2.6 million Georgians. I think there